afternoon, everybody. It's the most exciting day of the year. It's Think Tuesday. I'm here with my sidekick and co-host, John. What's up, buddy?
Thanks for having me on, Richard. This is a great privilege to be here.
I tell you what, and you can tell I'm pumped up. Our first guest of a whole day marathon, 8 hours of nonstop inspiring stories. We have Kim Bowles. How you doing, Kim?
Good, Rich. How's it going?
Good. As you can tell, I'm energized. So by 8 o'clock tonight, I'll still be energized.
I'm jealous, just a little bit.
So, Kim, where are you from? Tell everybody where you're from.
So I grew up in Seattle, but I've been in Pittsburgh for the last 13 years. So
are you a Steeler fan?
I'm not really a football. I don't really follow football. The Steelers are definitely a great team, though.
That's okay. We'll let you slide with that.
She didn't say she was a Seahawks fan, so.
No, I'm definitely not a Seahawks fan. Sorry, Seahawks.
No allegiance to Seattle.
No.
Not at all. But I tell you what, Kim, we're just going to deep dive into this. So tell us a little bit about what's going on with you right now. But let's go to A to Z from that inspiring story.
Okay. Boy, so it's quite the story, I guess. So I just want to say, firstly, that breast cancer affects 1 in 8 women in their lifetime and 1 in 900 men, I believe. So it's a pretty common thing, and you're never too young to get breast cancer. I was diagnosed when I was 35, and I had just had my second baby. I was breastfeeding her. She was 10 months old when I was diagnosed. And
wow.
I know, right? It was already, I had a 3-year-old and a 10-month-old. And so I was already kind of at my
35.
limit. At 35.
That's unbelievable.
Yeah, I was healthy. Otherwise, I was, I'm athletic. I'm breastfed my kids. I eat healthy. I don't smoke. I don't drink. Like, you're never too young, and you're never, you don't want to live your life in fear, but at the same time, you're never safe. You're never assured that you're not going to get it. So even if you think you're low risk, or if you think you're too young, just be aware of your body and, know your body, and just go to your doctor with any changes. And that's the best you can do.
That's so true. And Kim, even if you don't have changes, when should you start getting checked out? If you're male or female, I hear any days.
That's a good question. So they actually recently, the American Cancer Society, I think was it ACOG? I can't remember. It was some entity that had these protocols. They actually stopped recommending self-exams and started recommending instead to just be aware of what is normal for you. Because most, even young women who find their own lump, they don't typically find it on a self-exam. They typically find it sort of by accident because something didn't feel right. So you should be getting checked out. You should be talking to your doctor and getting your annual physical exam, first of all, every single year, even if you're busy, even if you have young children. And you should know your family history. You should know your genetic history. I mean, if you're at higher risk for breast cancer because it's been in your family on either side, your mom or your dad, you should speak to your doctor about that specifically, about maybe you might need to get started with screening earlier than the average, which I think is 40 or 50 now for women. They keep changing it between 40 and 50. Obviously, I'm going to say 40.
I'm sorry. Go ahead, Johnny.
I was going to say, so you mentioned family history. Were you aware of your family history, and was there any history of breast cancer on either side?
Yeah, I actually did have a family history of breast cancer. But it was all on my dad's side. And at the time, I thought, I brought this up with 3 different doctors, the family history, and they all told me, well, it's on your dad's side, so it doesn't matter, which that's completely wrong. Completely wrong. Obviously, you get
clearly
your dad. I just didn't think about it any further than that because I was postpartum and I was so overwhelmed with dealing with the babies that, I just didn't do my self-care. I didn't do my research at the time. And I regret that because it does run in my family. So if it runs in your family and you get diagnosed, you get genetic testing to see if you have a known genetic variant that puts you at higher risk. I did not have that variant, but still I had a strong family history, and I was diagnosed really young. My aunt was diagnosed when she was in her late 30s, and then again with a new primary breast cancer when she was in her 50s, early 60s, I think, late 50s,
Wow.
early 60s. So, getting 2 primary breast cancers, and then every woman on my dad's side had some sort of female cancer. So, really I should have been being screened every 6 months, but not all primary care doctors are up on that.
Hmm.
So that's why you have to be your own, advocate. And breast cancer is one of the really common ones. So, I urge
Wow.
everyone to think about their family history and to talk to their doctor. And if something doesn't feel right, just get a second opinion.
And you know what? We never think about that, asking our family members, our mom or dads or grandmas, was there anything in the
Yeah.
family?
The older generations often don't talk about it, or they'll just say, oh, I had a female problem, or, oh, I had some kind of cancer and it was somewhere, and they won't really be specific. And it was hard for me to get that information because my great grandma had passed. Obviously, her mother had passed, and we never actually found out exactly what it was, what cancers it was. We think it was ovarian, but we don't know for sure.
It is ironic that you're right. The older generations, and even if you go back and, even farther back, they didn't want to deal with those tragedies up front. They didn't want to call them what they were. They made up names for them. They called them something else to mask it, and for whatever reason. But I think society today is much more open about about illness and medical issues, especially when it comes to cancer awareness and breast cancer awareness. Lot more dialogue going on.
Yeah, and breast cancer is one of those ones that if you catch it early, you often do have a good outcome. I think the average survival rate is like 90% at 10 years, which if you think about it, that's 1 out of every 10 women diagnosed is not here anymore after 10 years. But compared to some other cancers, it's not too bad. And we do have screening tools for it. And you should know your individual risk. Look at your family history.
So you're dealing with what I can't wrap my head around is you've got 2 little babies, one of which is a newborn. And then I was just saying, and then this comes in mentally. What the heck goes through your mind at that point?
Well, the thing about it is you don't have a choice. It's like parenting and labor and birth and then parenting. You have to do it. So at a certain point, there's no going back. So when you're diagnosed, so as soon as I felt the lump, I knew what it was. I knew that it was cancer.
Mm-hmm.
And my first thought was, thank God it's me that has the cancer and not my children. And then my second thought was, of course, it's all about the children when they're that age, especially. How am I going to handle a toddler, a super high energy ninja toddler, and a bottle refusing colic baby that has breath holding spells? I didn't know what I was going to do. The only reason we made it through was because my mom moved out to stay with us during intensive treatment. A lot of people don't have that, and I frankly don't know how anyone with young children manages without help from their family.
Thank God.
Must be a lot of coffee, Kim. Is that what you drink all day?
At least 2 pots, big pots.
She's right up my alley, John. Right, 2 pots a day. There's the trick right there. Oh my goodness. Hey, Kim, tell us a little bit about all these organizations you're involved in. You're involved in so much stuff here with the Think Pink.
Yeah. So a lot of breast cancer survivors, it's sort of like people sort of take 2 paths after they complete treatment, and they have either no evidence of disease if they're early stage, or they're stable if they're metastatic. And by metastatic, I mean stage 4 disease that's spread through the body. It's fatal. It's almost always fatal. But they can, with treatment, a lot of times you can get to a point where your cancer is not progressing. Anyway, when you get to that point where you're sort of in your new normal, some people just want to forget about cancer and just avoid it. And that's totally fine. And then other people go into advocacy. They become either, patient advocates, or, get involved with helping other women have a better experience than they did. So that's why I'm in advocacy. I'm actually in flat advocacy. So opting out of breast reconstruction and trying to make sure women have their choice respected and have decent surgical outcomes. That's my niche. Somebody coming in my door here.
We're okay. We like to be live.
Yeah. yeah, so I got into flat advocacy when this is kind of a dramatic story. I went to Cleveland Clinic, so I'm in Pittsburgh, but I went to Cleveland Clinic, it's like a 2 or 3 hour drive, you know.
I know it.
Yeah, I mean, Cleveland Clinic is a great hospital. It's, it's a huge research center, comprehensive care. Anyway, my breast surgeon, when I told her I wanted to go flat, she said, "Oh, well, let's bring on a plastic surgeon so it looks nice," because she knew I was concerned with how it was going to look afterwards. I didn't want to be left with, a lot of extra skin. I just think it was disturbing to me to think about that. So we brought on a plastic surgeon, and he actually, instead of doing what he agreed to do, which was to make me flat, he decided to take it upon himself to leave extra skin intentionally in case I change my mind about implants. So my advocacy is not even really necessarily about cancer per se. It's about the one part of the cancer treatment plan that you really do have agency in, and that is the reconstruction decision. So I became an advocate after my consent was disrespected. My choice was disrespected. And so I realized over the course of the next year that this is like a big systemic problem. I'm not alone. So 1 in 20 women choose to go flat have this kind of an experience, actually. So I'm far from alone. And it's one way that I, as a survivor, can make if you unfortunately are diagnosed, the women that come after me, make sure that if they make that choice, that they don't run into that.
You create that awareness and let them know what's ahead of them and what they should look out for.
It's a systemic problem too. Like, there's things that individual patients can do. That's why on our website, on notputtingonashirt.org, you can see right there, not putting on a shirt.
Love it.
We have like a directory of flat-friendly surgeons who have a proven track record. We have like brochures you can print out. We have lots of information about explanting to flat and going flat initially, and etc. Lots of information for providers too. We have a gallery. We have lots of stuff. We also have a lot of
providers that will respect the woman's decision.
Right. That's right. Because I tell people this happened to me, and they're like, "What? How could that happen?" Especially at Cleveland Clinic. Well, the answer is complicated. Right? It always is. It's always complicated. There's lots of things that contribute to it. There's paternalism, where the surgeon knows best, right? Which again is more common in the older generations of surgeons. There's sexism, where the idea that women have to have breasts in order to be women. So if you don't want reconstruction, then you must not care how you look. So therefore, it's okay to leave you however and not do a nice job.
I can't comprehend that.
Oh, it's bad.
No, not at all.
I mean, it's not as bad as it used to be in some ways, but we're still not there yet to where we should be. And so that's where my work comes in. So we have a bunch of resources on the website to help women advocate for themselves. And then we do a lot of outreach to medical providers, and we support research on flat closure. We support legislative initiatives. We worked with the National Cancer Institute to get the term aesthetic flat closure onto their dictionary of cancer terms, so that women would have a clear language for what we want, instead of just saying, "Well, I don't really want reconstruction." That's not very clear. But the definition of aesthetic flat closure is basically chest wall reconstruction. So it's very clear. So you can communicate with your surgeon exactly what you want, and there's no ambiguity. And there's other things we're working on. There'll be a couple articles coming out about ethics and stuff like that in the near future. So that's all the work that I'm involved in. And all of those things I'm just trying to make sure that women's choice is respected in a way that mine was not. I don't want women to have to go through that additional trauma that I had to go through. And it's totally avoidable. Like totally avoidable. So.
And at that point, you've been through enough trauma already. Why add to it?
Exactly right.
Right. And a lot of women actually develop PTSD from this experience. And I just want to say most surgeons wouldn't do this, obviously.
But the fact that some do,
there's enough of them that do, right? And they do it, and it's good that that it's a problem.
Yeah. And it's great that you've committed yourself to making, being an advocate and letting people know what's out there.
And I am walking in the footsteps of other flat advocates who have gone before me. Audre Lorde,
Yeah.
Sarah from Flat and Fabulous. There's so many flat advocates. Rebecca Pine, I can't even count. So they've all laid the foundation for the work that my organization is doing. So just taking up the banner and trying to get to the goal.
And that's incredible work, because I didn't realize this, but it's your body. You should have a decision in this.
Right. Seems pretty obvious, right?
Not being persuaded by somebody who has a doctor's license. I mean, that's, I mean, we got to keep it real. I mean, it's like, wow.
Yeah, it is. And I mean, it's sort of an easy problem to solve in that sense. Like, there's nobody that's going to argue that that's okay.
Right.
So,
that's true.
There's no counter argument. It's just a matter of doing the legwork to get there.
Wow, John, I love this stuff that you're giving back. And I got to tell you, what's going on with you right now and in the future? I mean, is there anything exciting you want to tell us about?
Well, I've been traveling around for Breast Cancer Awareness Month to support the events that my flat advocate friends have organized. They have a campaign called Stand Tall AFC, Stand Tall Aesthetic Flat Closure. The Simpsons just aired an episode with a one-breasted character living flat. Her name is Sage. Yeah, so that was a big component of the campaign, and that just aired on the 24th, I think, which was 2 days ago? Yesterday? Very recently.
2 days ago, you're right.
2 days ago. Yeah, and it's being covered by the media, which is great. We did a couple of walks where we took our shirts off and marched with our posters, and it's about breast cancer awareness, but it's also about awareness of flat as a legitimate choice. You don't have to hide it. You don't have to be ashamed of what you look like. You can get a tattoo. You don't have to get a
I love it. Just live free all the time. I love it.
Free. Exactly. That's exactly right. And that's all we're saying. We're not even saying going flat is what you should do. We're just saying it should be, an option on the same level as the other ones.
Right. You should feel good about your decision, and you shouldn't view someone in any other light if that's their choice, because they're still the same person.
We are still the same person. And my kids can tell you, this is me.
Mom is still mom.
This is me.
This is me. This is mom. I'm the same person. I'm still a woman. I still have a loving husband. I still, run. Actually, it's easier to run and swim. Jeez. Talk about weight off your chest.
When's your next marathon? I'll be there to cheer you on.
Unintended.
Guys, it's seriously so much more comfortable. I mean, I wouldn't have chosen this method, but
I don't think I would know that. But that's
now you know.
That's right.
Yeah. So how am I doing now? So I actually was really lucky to respond really well to my cancer treatments. So I have had no evidence of disease for 4 years now.
Excellent.
Yeah, and that is thanks to cancer researchers and Herceptin. So I had a HER2 positive disease, which is just a type of breast cancer that responds to this certain specific drug. And no evidence of disease. And so that's the best you can hope for. I've been rehabbing my body physically and mentally and emotionally for a while. Still have to take care of these little kids, though.
Yeah, you can't quit that job.
Yeah, and then the pandemic hit, so pandemic homeschooling, do not recommend. Do not recommend.
If you do that, 2 pots of coffee a day, guaranteed.
That's right. That's where the coffee comes in.
I could not even
keep it coming.
My kids are old. I'm an empty nester, and I could not imagine having kids home during the pandemic, let alone homeschooling them. That takes extraordinary capabilities. Right?
So Kim, you got to tell me, what's the best cartoon out there now? I'm sure you know what's going on, right?
The best cartoon? Obviously, The Simpsons. It's been the best cartoon for the last 30 years, I think.
Wow.
Does your kids watch it too?
Well, yeah, my kids watch it. I'm pretty liberal with the TV. My youngest likes horror movies.
Yes.
Don't ask me why.
Halloween.
Do they like scary?
Bluey. They like Bluey. It's a dog. You seen this one,
Okay.
Bluey?
As long as they don't like Chucky, we're okay, because Chucky still freaks me out.
It's okay. I look forward to getting to the point where I don't recognize the current kids' TV. Right where you guys are.
Oh my, I love it.
And my
Oh,
youngest is 21, so I've been through the whole phase of it. When my kids were little, it wasn't Bluey, it was Blue's Clues.
Blue's Clues, I remember, and that guy came out with some sort of a statement during the pandemic, didn't he? Do you
Oh, I
remember?
don't know. Did he?
Yeah, he came out and he was like telling everybody, all the Gen Xers and the
oh boy.
elder
Huh.
millennials, that it's going to be okay.
I didn't know that.
Yeah.
Oh my goodness.
Oh, the internet.
That's
I
right.
love it, Kim. Well, hey, you look great. Good inspiration here. Where can anybody like reach out to you? Because I know there might be somebody in the audience that's maybe connects with you and maybe want to talk one-on-one, private, and just, you could help them out anyway.
Yeah, just go to notputtingonashirt.org. And I should tell you really briefly the story that Not Putting on a Shirt. Do I have like one more minute to tell you the story of
Hey, I don't even have a watch on. You're good. Keep rolling.
All right, good. None of us even have watches anymore. We all use our cell
No,
phones.
I know. It's true. I haven't worn one since I've had a phone.
We're on Jimmy Buffett time. It's all good. Go ahead.
One less thing to lose, right?
You're right.
So Not Putting on a Shirt is, after my surgeon decided to go against my wishes, I tried to get the hospital to acknowledge what happened and make sure it didn't happen to other people. And they just failed. They would not do it because they didn't want to acknowledge that happened on their watch, I think is what it boils down to. So I staged a topless sit-in in the CEO's office. And the cops dragged me out.
No way.
During that topless sit-in, I caught it on Facebook Live. During that sit-in, the guy asked me to put on a shirt, and I said, I'm not putting on a shirt. So that's where the name came from.
That's a great story.
I love it.
Oh my God. Topless anymore in CEOs' offices.
I'm guessing you got your point across, though. I'm guessing you got your point across.
I think I did.
Yeah.
At least somebody dropped the charges, right? Did they drop the charges?
Sometimes you've got to do things that you didn't think you were capable of doing if you're the one that has the opportunity and the ability to do it. I'm still here. A lot of my breast cancer sisters are not. Like a lot of the women I was diagnosed with around the same time, they're not here. So I really feel a responsibility, and I think most survivors feel this way. I have a responsibility to do what I can, hopefully make them proud maybe when I see them on the other side.
Awesome.
I tell you what, John, that story alone, just wow, that's over the top, right?
There's
that's
so many. Every woman's story is unique, and some of them are splashy, some of them aren't, but everyone's unique. And so
can't thank you enough for being open and vulnerable enough to share it with us. Appreciate it.
Yeah,
sure. Yeah. So if anyone wants to contact me, go to notputtingonashirt.org. And then you can find the contact form there. That's probably the easiest way to do it.
Well, hey, Kim, once again, thank you so much for coming on the show. I mean, this is inspiring. You're the first one to kick it off. So you're the initial one. So everybody has to follow after you. But no, we're all a team.
Make me look bad. Make me look bad.
Hey, that story alone, I'm ready to hear the rest of the stories. Wow. I mean, that's just inspiring. But look what happens.
Yeah.
You enact and you develop an organization. See, just like that.
Yeah. You gotta go for it. You only live once, right?
It's true.
Right. Awesome. Wait, Kim, once again, thank you so much, dear. We'll be in touch in the near future. And if you need anything, reach out to us. We're always here for your support. God bless you.
Thank you so much, guys.
Continued health to you.
Wow, Johnny, that was really inspiring there, wasn't it, my man?
That, yeah, I would say so. She's quite a woman, pretty strong. And I admire her courage in going after, what she wants to advocate for. I'm ignorant, like probably most men, to stuff that victims of breast cancer go through. I mean, I've had family relatives that had cancers, but I've never had anybody close to me that's had breast cancer. So I didn't even know that was even something, you think when you tell a doctor that this is what I want to do, you think it's going to get done. God forbid. How do you just ignore, someone's wishes and requests? That's
exactly right. And if somebody, doesn't want, that, they can go either way. I think that's the biggest thing, John. People has to stand up for their decision. That's the biggest thing that we learned from that.
People have to stand up for what they want, and other people have to respect what they want. I mean, our society is so damn judgy nowadays. It's like, get over it. Respect people's wishes and just let people do what they want to do and respect it, admire it, praise it. Don't judge it.
And all I can say is stay in your own lane. That's the best way to say
There
it.
you
Stay
go.
in your own lane.
Stay in your lane, dude.
You know it, dude. But before we bring our next guest on here, I want to give a shout out to our proud sponsor here. Our sponsor for the whole day event is Toothman Ford down in Grafton, West Virginia. They are big breast cancer advocates. They do so much down here in the West Virginia area. And I just want to thank them for sponsoring the whole day podcast. So if you need a truck or a car or anything, you got to give Toothman a call.
Go get that F-150.
You got it, buddy. Or the new Bronco, right?
That's right, the new Bronco.
It's pretty badass. So you ready for our next guest? I mean,
absolutely.
We're gonna bring her on. She's backstage right now. She's in our industry. Here she comes right now. Hey, Beth, how you doing?
I'm doing great. How are you two?
Good to see you.
Good. And great seeing you. Richard, thank you so much for having me here. It's a pleasure and a privilege to be able to share my story. But Kim's story was just off the charts. I mean, emotional. I'm dealing with a little of that right now, and I'm sure some of our viewers can relate. But what a hard story to follow. Just so proud of her for everything that she's accomplished and what she's doing to help other women that are dealing with breast cancer and those that hopefully aren't, but to prevent breast cancer, just some great things that she's doing. And I can't say I've ever staged a shirtless protest. So and speaking of that, Richard, I love your shirt.
Well, thank you so much.
Yeah. So appropriate.
And you know what? I got the glasses to go with it now. I can't even see, right? It's all good.
There you go. You can't see Beth, the tears in the corners of your eyes, so maybe I should find some shades. Well,
if anybody knows me, I don't have the best vision on a computer, so right now, if I start hitting stuff, look out. We might be all over the place, but we know Beth real well. Me and John, we had her on some of our shows before talking about staffing and recruiting, but now it's a different subject. So, Beth,
sure.
It's the forefront, Beth. Give us A to Z. We just want to hear your story, dear.
Well, the good news about me is, and I'll start with this. Just last month in September, I celebrated 5 years of survivorship from breast cancer.
That's outstanding.
Woo, yes.
That's big.
It's a great feeling. It's a great feeling. And I've been followed every 6 months, and now it's every year since I'm to that place in my life, in my survivorship, where I'm cancer-free. Mammograms every year now, and then every 6 months my oncologist and the physical exam with him. So Ohio State will not let you fall through the cracks, that's for sure. They have been a tremendous support for me, as has my family, my friends, my colleagues, through this whole process of over 5 years now. I was diagnosed in September of 2016. I had no idea I had a lump in my breast. And the night before I went to the doctor, I had a scheduled physical exam one day that year. And I just randomly did a self-breast exam. I mean, I didn't do them regularly like I should have, like we all should. But I found something, and it scared me to death. I didn't even dream that I had cancer. I wasn't sick. I was working. I was, taking care of my family. Had 2 grandchildren, 1 grandchild, and 1 more on the way at that time. I'm sorry, John, what was that?
No, say you felt fine?
Yeah, I felt great. Not sick, not tired, any more than normal. But when I went to the doctor, of course, I told her about it, and she examined me too. Sure enough, she felt it and immediately referred me over to the facility for the ultrasound, and then subsequently the biopsy. All took place in the matter of 2 hours after
Holy cow.
she felt that lump. Wow. So they moved very quickly. And I think, looking back on all of that, thank God they did, because I was already at stage 2, which means that my cancer tumor, they diagnosed it as a stage 2 breast cancer. They told me that right away. It was hard. It was very emotional. My husband was with me. Thank goodness I didn't have to hear that alone. It just never occurred to me that I figured it was probably just a cyst. I mean, everybody has
Mhm.
cysts. All women get them.
Yep.
Sometimes, they go away, they come and go, throughout our lifetime as adults. And especially since I was or at that point in time, I was postmenopausal, of course, still am. Um, I didn't even dream that I had cancer. Nobody in my family, in my immediate family, not my mother, not my father, no one had been diagnosed with cancer. I did find out that my 2 aunts had cancer, and then I had a half sister. On my dad's side, kind of like what Kim said, I didn't
Hmm.
expect. On my father's side, there was someone that had cancer. She was my half sister. I just didn't think it would be hereditary. And it doesn't have to be hereditary. That's the other kind of misnomer out there. People think, oh, it's hereditary. I'll get it. And then if nobody has it in their family, I can't get it. That's not true, because everyone is susceptible. Cancer does not discriminate. Whether you have a family member or not. I mean, it's always good, obviously, to find out your family history and then act accordingly. But you should always, ladies, do your breast exams every month without fail. And like Kim said, you need to know what feels normal. And then when something doesn't feel normal, you need to act on it right away. Never put it off as something, I can't possibly have breast cancer. And it's a good thing I didn't put it off, because it was starting to grow enough to become stage 3. And,
Thank goodness you
stage
didn't.
4 is the worst. So, yeah.
Because I know, I imagine there's a fear, because you don't want to go get it looked at because you're afraid of what might happen. But in the same light, if you don't, it could make it much worse. So I get that emotional
Exactly.
turmoil.
Yeah. So mine was so advanced, and it was estrogen fed, that immediately they had to start chemotherapy to cut down the size of the tumor. My first thought was they'll probably do surgery and get it out of there. I mean, that's what I
Mhm.
wanted.
Yeah.
Get it out of there, right? So it doesn't grow or
Right.
spread. But the thinking of Ohio State Oncology was, let's shrink the tumor. We won't have as much to remove. And that's exactly what happened.
Hmm.
I had surgery in February after 6 chemotherapy treatments. I had the full-blown 4 different medications of chemotherapy every 6 weeks. I worked with this, guys. I mean,
Oh,
it wasn't easy, because,
I was going to say, you must have had
chemotherapy,
some rough days.
it was rough. It was rough. There, the side effects are not pleasant whatsoever. I lost all my hair. Now, all this thick stuff came back, believe it or not, but I was completely
looking great.
bald. I wore a wig for a while. And then, of course, my family, when my hair started growing back in gray, they're like, oh, Mom, that looks so cool. You look like Sade. You're rocking that gray hair. But then every time I looked in the mirror with gray hair, it took me back to those times where, I didn't feel so well, or, emotionally and physically. So
Hey, Beth, that's gonna be your
I
nickname
grew it
now.
out and colored it again. But here we are, right? But after all that chemotherapy, it shrunk down to less than 1 millimeter size tumor.
Holy cow! How large had it grown?
It was 3 centimeters.
Whoa!
Yeah.
And it shrunk down that much.
Wow.
That's a huge
miracle.
difference.
Wow.
Huge. And that was from September, when it was originally found, to February. So what?
And it stayed contained, I imagine.
5? Yeah, it did. And actually, there's a danger it can move into your lymph nodes, obviously. And once it moves into your lymph nodes, that's the metastatic part that Kim had mentioned. It can go throughout your body, throughout your lymph system. So I was very, very fortunate that they tested 3 lymph nodes. Cancer was in none of them during the surgery. So I was lucky.
Wow.
And chemo took care of it. And then after the surgery, after I healed, they just had to take out the lump. I didn't have to have a mastectomy, thank God. But I had to have, I think it was 25 radiation treatments
25.
in a matter of 10 weeks. So I was going, about every other day to radiation at Ohio State, and it took care of it. I mean, when you get diagnosed with something so drastic as cancer, your body and your physical actions just go into, I got to take care of this mode. You want to live. You want to live. I mean, it's like survival of the fittest, right? I mean, that cancer kills. There's no cure for cancer. I mean, obviously, there's treatment that can eradicate it, like in my case and many other cases, but you just do what you have to do. And I think it's my main thoughts went right to my new little granddaughter, who was only 2 years old at the time. And now I have another grandchild and another one on the way. So, I fought the hard battle for my family and especially my little grandchildren. And I think that's what got me through, and the support of everyone. As I mentioned, I couldn't have done it without everybody.
Well, and from what I've learned, again, I haven't had anybody close to me with breast cancer, but both my parents passed of cancer. And what I've learned is that it's very much a mental game, just as much the physical game. Like, you have to really get your mind set that I am fighting this thing. And
Right.
do you agree with that? It sounds like you were pretty driven to do so, and that you kept that mindset of, I'm going to beat this.
Yeah, I have to agree with that, John. That's what was in my brain. I didn't care what happened, what I looked like. I gained a bunch of weight because chemo tends to, make you do that. But then at the same time, you're sick. So you think, how am I keeping this weight on because of all the side effects and everything? But it takes a toll on your body. I read somewhere where having cancer can take off anywhere from 4 to 10 years of someone's life.
Wow.
Yeah.
Just because of what you go through during it.
Yeah. Yeah. Because I mean, when you think about it, chemo is poison.
Yeah.
I mean, it's poison that is going through your body to heal you. But nevertheless, it's not the greatest thing in the world to be putting in your veins, but it was my savior. If they hadn't had chemo, if people hadn't been donating to breast cancer organizations out there, like the walk we have every year in May in Columbus, except for the pandemic, we didn't have it. That was something I've participated in 3 times now. And it's a tremendous organization to donate to. They do breast cancer research all the time. That's what their primary, and I think their only objective is. All the money goes to breast cancer research and trying to find a cure and trying to find, chemotherapy that work for certain kinds of breast cancer, because there's all kinds of different kinds of breast cancer. Kim kind of alluded to that. Hers sounded a lot like mine, that it was HER2 positive, there's HER2 negative, and it just depends on what they find in the lab in terms of what your breast lump has in it, chemically, what's going to fight that particular kind of cancer. So it can get really complicated, and I don't want to go into all of that science, but it's just so good.
You've probably learned more than you ever thought you needed to or wanted
more
to.
than I ever wanted to, right? Exactly.
And everything was done at Ohio State, correct?
Yes.
One place. That's amazing.
Yeah.
The Ohio State University.
Center.
Go Buckeyes.
Yep, go Bucks. So the Stephanie Spielman Center is where I got my treatment, and that's where the chemo is administered. They were wonderful. I mean, they treated you like family. The nurses there are just fantastic. I'm not trying to put a plug in for them, but I'm just saying.
Oh, you can do that. Go for it.
Personally.
That's right.
Personally,
Absolutely.
I had the best treatment I think I ever could have had anywhere. So.
That's awesome. And it sounds like, from what you described, I was trying to piece it together. What was the timeline from the time of diagnosis to the time where you were done with treatment? Because it didn't sound like it was that long a time.
It was about a year, maybe a little more than a year. I started treatment right away. It was in October, the month after I was diagnosed. And the surgery was in February. And then the radiation or the chemo was over by then. But then I had a year-long chemotherapy that I had to extend because of my type of aggressive cancer. They needed to make sure, that I had that extension. And I would just go once a week for that. And it didn't have any side effects like the initial chemotherapy did. So I was able to live with that year. So a little more than a year total.
So it probably felt like a lot longer.
Yeah. But, again, I was just so grateful for the treatment and being able to.
Thank God you had aggressive medical professionals working with you too. That I can't believe that within 2 hours of that initial examination, they were doing a biopsy. I mean,
They were
that's
on it, man.
unheard of.
Yep.
Expertise. Wow.
Yep. They moved. and fast. And that scared me because I thought, okay,
Well,
if they didn't
Yeah.
suspect something, they wouldn't be moving this fast. So I was grateful for that.
Hey, Beth, how about the support groups through all of this? Were you involved in any support groups from like day one to now?
I am. I do online support for women that are initially diagnosed. I try to give them motivation and inspiration as much as I possibly can. Thinking back 5 years ago, what I went through and how I felt, and just being that person that lets them know you're not alone in this. It's sad to say, but 1 in 8 women will be diagnosed with invasive breast cancer over the course of their lifetime. That boils down to about 13%. So there's a lot of us out there, that have been or will be diagnosed. And
it's a big percentage.
It is of just making sure you do your self-care, your self-breast exams, your physical exams, so important on a regular basis. Just, know your breasts. That's all I can say. Know what's normal, what's not normal, and act on it if there's something that's weird, as quickly as you can. Don't be afraid of that, because like me, you could be a survivor and you don't want to let it go too long, because time is of the essence when you discover something or your doctor discovers something. And be your advocate for yourself health-wise. If your doctor thinks, we'll watch it for a few months, see if it grows. No. No, you tell them. Tell them I said that you need to get that checked out more invasively, because, who knows? You never know until you have that biopsy.
Is there, so on the last, what Kim was talking about, I'm sure you encountered some amazing medical care. There are some medical professionals, to your point, that are not as aggressive or more lackadaisical. In the support groups, is there a list of known or recommended oncologists, physicians, et cetera, that they know people have gone to, and they've treated it the way that people would want it to be treated, versus going to an unknown saying, hey, it's first time I've had to go see somebody. Who do I go to?
Actually, I have never heard anybody say, most of the people that I've talked with as a volunteer have either been with Ohio State or Mount Carmel, and Ohio Health is another, and they're all good in their own respect. And
Sure.
Again, we just have to step up and be an advocate for ourselves. A lot of us aren't medical professionals. A lot of times we don't know what to ask, even because not everyone can be, medically proficient, with these diagnoses, with the terminology, with, asking the right questions. So, I encourage everyone just to do your research if you don't know, or talk to somebody who does know, that you can trust and that will give you the right answers and not put you off. That's the best advice I can give.
Always in high spirits, Beth. You are. Where can people reach you at? Because there might be somebody, like I said last show, that's out there that just wants to connect with you.
Sure. I know this isn't about recruiting, but probably the easiest thing for me.
Oh, here we go. We're going
That's
into
it.
the staffing industry.
Once a recruiter, always a recruiter.
My recruiting business email, and that would just simply be my first name, Beth.Wood, WOOD, at expertrecruitingsolutions.com. So
good stuff there, Beth.
I check that all the time. So please reach out with any questions, anything I can do for you, even if it's just to lend you an ear, a friend to talk with over chat or Zoom. I'm here.
I get the impression it's a pretty warm, tight-knit community.
Yes.
Yeah, it is. I appreciated all the volunteerism that I received when I was down with cancer, and I couldn't do my housework. And my husband's probably not the greatest housekeeper, but
say that one more time.
But he's wonderful otherwise. So I had these ladies come in that only Ohio State has, to my knowledge, called the Pink Ladies. And they were literally fabulous with volunteering their time to clean my house, do my laundry, cook meals for us. So, if you are going to Ohio State, or maybe there are some other ladies out there, with other healthcare systems, but take advantage of that opportunity. It's just so helpful. And I'm so thankful to them, you know, for all their time and energy coming in here to help us.
Never forget it. And pink ladies, man, we should have pink men. I can cook too, right, Beth?
Good for you, Rich.
Oh, well, your husband, if he watches this live, he's going to say, you're getting McDonald's tonight, Beth. You know that.
Well, thank you guys so much for having me on the show. I hope
thank you for being here
inspired.
and for sharing. Oh gosh, yes.
You're very welcome.
That's what it's all about. 5 years, 5 golden rings is what I'm going to say. Yeah. Wow, that's great. Working on year number 6. But hey, thank you so much for your inspiring story, Beth. And we'll talk to you soon, okay, Beth?
Okay, thanks again, guys. Have a great day.
Awesome.
Wow.
Another wow guest. What do you think,
John? Right. I was going to say we had a note from Sean. Sean was going to tell her to bring the short haircut back, which is just amazing women. And you know, each one of them has their own unique story and how they've been affected and how they dealt with it and what happened. It's just inspiring to see their courage and educational to learn, because, you know, a lot of people, myself included, are pretty ignorant of the whole world of breast cancer, because unless you've either gone through it or you know someone close to you that's gone through it and you've gone through it with them, like most other topics, you have no idea how complex and how deep it runs.
So true. And, you know, when it hits you right, and I mean, you never prepare for this. It hits you right in the face, and then you got to deal with it like that second, you know, and it's something that's life-changing.
It's like, you know, what are you going to do? Are you can, you know, literally lie down and die if you want to give up, or you decide, okay, what do I do to fight it? And, you know, you look at, I mean, the severity of the cancer, how advanced is it? I mean, she was on stage 2. To my knowledge, there's only 4 stages. So that thing was progressing pretty fast. But regardless of the stage, it's like cancer can move at a lightning pace. So I respect the fact that she advocates for, hey, don't wait. If your doctor says, hey, let's wait and see if it grows or whatever, you know what? A month from now, that thing could be exponentially advanced. And why take the risk? I was blown away by the fact that she said within 2 hours they were taking a biopsy. That's amazing, urgent medical care right there.
And you know what? I want to give them praise, Ohio State, because that was something that somebody made a decision that we're going to just shrink this instead of taking it out. And it was an incredible outcome.
Amazing. Yeah. Praise to the Ohio State University.
Might win a national championship this year, but tell you what, we're going to take a little break here, but I'm just let everybody know, donate. Check out below. We have a great organization we're helping out today. You know, it's about awareness for young people, because you know what, any young girl or even guys, you all got to get checked. There's not a certain age that you say, well, I got to wait to this age. Get checked, please get checked. That's what this is all about. Spread the awareness. Hey, John, I want to thank you, buddy, for coming on for the first couple of shows, man. I tell you what, you'll be watching.
I appreciate being here. I love what you're doing, Richard. I respect the hell out of you and the cause. Just thankful that I was able to be a part of it for an hour or so. So good luck with the rest of the day, and hats off to all the ladies.
I will. And hey, everybody got to stay tuned. We got another guest coming up very soon. And just to warn you, the pink hair is coming soon. Look out.
I want a picture.
John, thanks again, buddy. We'll see you guys in a short break.